Good morning. My name is Kevin O'Neill, and today I will be presenting on the 2022 cholera resurgence that was in Haiti and the Dominican Republic. In this presentation, I plan on explaining what caused the outbreak, how it kind of affected their health, their society, their economy, which organizations were responsible for the response, and some of the major challenges that they faced. Towards the end, I'll give some recommendations that could be used to improve future response efforts. Um, but cholera is not a new disease in Haiti. Its reemergence in 2022 actually just shows how fragile their public health systems can be. And this goes for anybody. When public health systems go with long-term infrastructure issues, um, when these issues are not addressed, it kind of exacerbates not simple issues, but issues that are easily mitigated. So, to begin, cholera is caused by a bacteria called Vibrio cholerae. It spreads mainly through contaminated water and poor sanitation. In October 2022, Haiti officially declared a cholera resurgence, and this was after several years without a confirmed case. According to public health reports, the outbreak quickly spread in areas where access to clean water and sanitation were already limited. And because Haiti shares a border with the Dominican Republic, there were immediate concerns about cross-border transmissions. This situation kind of highlights how infectious diseases do not respect political boundaries and that one nation's issues will could easily reflect on another nation's economy. And we'll get to that in about a slide or two. This outbreak occurred during a time of political instability, and there was a lot of gang violence, which also added to the issues and made response efforts even more difficult. So, going into human health impacts, um, pretty important. There were over 52,000 suspected cases in Haiti, more than 700 deaths, with majority or a good amount, I wouldn't say majority, but a good amount of children, uh, percentage wise, in those deaths. Children were heavily impacted because they're more vulnerable to dehydration and their stomachs are more prone to have severe, be caused by severe diarrhea. Cholera can kill within hours, especially with lack of clean drinking water. It's deadly in hours because of dehydration. It also needs antibiotics to cure. And so the biggest issue really wasn't medical knowledge. We all, Haiti and the Haiti government knew what was needed. The biggest problem was the access to the resources that were needed. It was hard to get antibiotics. It was hard to distribute clean drinking water. This limited access to clean water significantly increased the spread of the disease, and many communities relied on these shared water sources that are easily contaminated. So this kind of just shows how public health emergencies are often tied to infrastructure and even living conditions like shared community water. So beyond health effects, this outbreak created some pretty serious social and economic consequences for both nations. Socially, there was a lot of fear and mistrust among these communities. Some people were hesitant to seek medical care. Hospitals were pretty overwhelmed, and healthcare workers were stretched extremely thin from the vast amounts of confirmed cases. There was also a displacement in certain areas due to the gang violence and instability, and this made sanitation even harder to maintain with people fleeing from this instability. Economically, the healthcare costs increased significantly. Cross-border trade between Haiti and the Dominican Republic slowed exponentially, and tourism concerns also began to affect the Dominican economy. And this is because outbreaks tend to cause this damage to international reputation. A lot of people were scared that the cholera outbreak was going to also travel into deep parts of the Dominican Republic. The Dominican Republic's major economic driving force is their tourism. Haiti remains heavily dependent on international aid, and this shows how disaster response will often require global cooperation. So now these are really the organizations involved with the response. The major international organizations really include the World Health Organization, or the WHO, and the Pan American Organization, the CDC, or the Center for Disease Control and Prevention. They really just supported surveillance and technical guidance. But both the Haitian and Dominican ministries of health played leadership roles within these countries. They did have like an NGO presence. The non-governmental organizations such as like Doctors Without Borders and the Red Cross really helped us provide treatment centers. They also helped provide supplies and gave some community education on sanitation efforts. This multi-agency response really reflects on international public health network working together during a crisis. Now, the two major challenges. Despite strong international involvement, there were really just these two issues. The first, and probably the most important, was the political instability. Political instability and gang violence through armed groups that controlled these key areas of distribution, like cleaning water, clean drinking water, and fuel terminals. With the fuel terminals being taken over by these armed groups, this kind of disrupted the transportation of medical supplies and clean water, which was the two most necessary things to fight the disease, really. The second one was the collapse of the water and sanitation infrastructure. And this kind of started before the outbreak. Haiti's always struggled with access to clean water, but with the official collapse of the water and sanitation system, it was almost like trying to put a fire out with dry paper. These challenges kind of demonstrate how public health is connected more to governance, and infrastructure really plays an important role in the response. Looking at the response overall, there were some strengths and weaknesses. Starting with the strengths, one of the major strengths was rapid vaccine deployment. There were oral cholera vaccines, and those were distributed to high-risk communities primarily. This likely reduced a lot of deaths. And another strength was the international coordination. All of the agencies from slide 6, they all shared data and resources, and volunteered their expertise pretty quickly, and likely saved hundreds of lives and halted the spread of thousands of more cases. Despite this, there were some weaknesses as well. The response was a reaction. It wasn't proactive. So investments in long-term water infrastructure were not prioritized before the outbreak. Um, and this pattern has happened before in Haiti. This includes after that 2010 earthquake cholera outbreak. This shows that emergency response is not enough if there's no long-term planning. So based on all this, I have really four recommendations. The first one is to being the first one is to invest in these long-term water and sanitation infrastructures. Prevention is more cost effective than emergency response. So I think it'd be more important to invest in this long-term planning process. The second is to strengthen that cross-border agreement between Haiti and the DR, especially for their disease surveillance and information sharing. Third, I would improve crisis security coordination so healthcare workers can safely access affected areas. And finally, I'd expand community sanitation education so individuals understand the actual prevention methods before it is too late. These steps could really reduce these future outbreaks and also improve the regional stability. So, in summary, the 2022 cholera resurgence in Haiti really demonstrates how infectious diseases are deeply connected to infrastructure, political stability, and cooperation. The outbreak caused over 52,000 suspected cases and more than 700 deaths. It created serious social fear and economic strain. And while international coordination and vaccine disruption were strengths, long-term infrastructure neglects remains a major weakness. This study reminds us that disaster response must be beyond short-term emergency action, and sustainable health systems are essential for preventing these future crises. I want to thank you for your time, and I look forward to any comments or questions on improvements in the future. Thank you.